So imagine you're driving down the road and you look at a text message, you veer off the road, and next thing you know, you wake up, there's blue lights and red lights, and you don't really know what's going on, but there's a lot of people around you, and one of them's going to be more than likely a paramedic. Today, we're going to talk about some of the things that's required to be a paramedic, some of the things paramedics do, and some of the things that are on an ambulance where the paramedic will work at. So, first of all, to be a paramedic, you have to go through several different types of training. One's going to be classroom, the other's going to be clinical hours, field internships. Just the classroom part of the paramedic program is roughly 700 hours. After that 700 hours comes your clinical experience. 250 hours would be on the ambulance as a student with another EMS crew, and 125 hours would be in the emergency department, assisting nurses, performing the skills that you would do on the truck while in the emergency department. So some of the history of EMS is that roughly around 1950, people started realizing that there was a need for medical care outside of a hospital. And that time, there may have been an ambulance, but the people on it were not trained. It was pretty much pick you up, take you to the hospital. So the first true paramedic program was Los Angeles Fire Department. They started it, and many people realized that because of the show Emergency. And some of the skills that they did then are still prevalent today. Some of the things that paramedics do: airway management, cardiac dysrhythmias, chest pains, breathing difficulties, bleeding, traumatic injuries, basically anything that you can think of, paramedics are trained to handle. Some of the things that paramedics use to handle those situations are going to be on the ambulance behind me. You can see different splints, oxygen. One of the most prevalently used drugs is going to be oxygen. It's basically used on near about every patient. You can see several different things: stair chairs, more splints, different devices to splint, different devices to help people out of vehicles after they were injured. Where the action really happens at is on the back of the truck. You can see here our stretcher. This is somewhat like a small room in a hospital. All the supplies that we carry on here: bandaging, IV supplies if someone was needing medications by IV route, IV fluids, volume replacement after traumatic injury from a severe hemorrhage. Also, one of the big things that paramedics are trained on is immediately life-threatening situations, such as cardiac dysrhythmias, cardiac arrest, bradycardia or slowed heartbeat, tachycardia or fast heartbeat. Either one of those things, any of those things, paramedics that's their number one thing, is to early recognition, early diagnosis, and early treatment. You can see here is our cardiac monitor. We use this to monitor patients' vital signs such as blood pressure, oxygen saturation, heart rate. We also use it to monitor the way someone's heart beats, or their EKG. EKG is basically where electrodes are placed on your body, and you look at the way that electricity flows through your heart. Many things can be determined by that EKG. Something else our cardiac monitor does is defibrillation. Everybody's seen on TV where somebody goes into cardiac arrest and they're immediately defibrillated. It doesn't quite work like that, but in certain situations they require defibrillation or shocking of the patient. This cardiac monitor also takes care of that for us. Some of the other things you can see are obviously the radios that we would use to call the hospital, let them know what we're coming in with, oxygen delivery systems, all of our airway supplies or nasal cannulas for oxygen that goes in your nose, masks for oxygen, nebulizers for breathing treatments. You can also see back at the back, in our back cabinet, that's where all of our IV supplies are, where we start our IVs. That's where all of our airway supplies are, such as intubation or placing the tube into someone's throat, breathing for them. Jump bag. All of our medications are in here. Also, several of the things that we talked about on the truck are in this bag, so they can be used either at the scene of an accident or in someone's house. Portable oxygen for same situation. So the main thing we want to talk about today was kind of what a paramedic was, some of the things they did, and some of the equipment they used. I hope this speech was very informative to you, and I thank you for your time.